Welcome to the Wava Circle, real talk on fertility, wellness, and trying to conceive. I'm Gabby Paychev, founder of Wava Health and fertility educator. This podcast is your community space for navigating the path to parenthood with evidence based insights, authentic conversations, and genuine support. I'm dedicated to being here with you through every part of your journey. Welcome back to today's episode. I'm here with Chelsea Angeski, a licensed doctor of physical therapy and women's pelvic health physical therapist who empowers women to feel strong and confident through fertility, pregnancy, postpartum, and beyond. We've previously explored pelvic floor health during fertility, but today we're expanding that conversation to cover the full spectrum from preconception through pregnancy and postpartum. So let's get started, Chelsea, and talk about why your pelvic floor deserves attention at every stage of your reproductive journey. How important is it to address pelvic floor issues like urinary and fecal incontinence, pelvic pain, sexual dysfunction, pelvic organ prolapse symptoms, pelvic floor muscle tightness?
Yeah, great question. First, thank you so much for having me here. I'm really excited to talk to you about this today. Basically, if you think of the pelvic floor muscles are the muscles that are responsible for the functions of the pelvis. So we kind of weed that down to peeing, pooping, and having sex. And so those three things are what our pelvic floor muscles are primarily responsible for, as well as supporting our pelvis and our low back and our hips. Those are other important functions. But when we're talking about preconception, pregnancy, and postpartum, really what we're talking about is if you have any symptoms related to peeing, pooping, or having sex, that means that there's muscle dysfunction in the pelvis and things aren't operating or functioning the way that they need to or in a very healthy way. We just know that they're not functioning healthily. And so it just sets the stage for there to be more difficulty potentially either in conception or even during pregnancy and postpartum. So the pelvis is going to change in through those stages. And so already starting from a level of having some dysfunction of those muscles is going to lead to some dysfunction or worsening dysfunction as you go through those stages.
Makes sense.
Yeah.
You just explained why these symptoms matter for people planning pregnancy, but would you mind touching on that a
Yeah,
little bit?
definitely. I mean, I think particularly if you're trying to conceive through sexual activity, if you're having pain or dysfunction in the muscles, we know that you're not getting support from your pelvic floor muscles for conception. If you have a lot of symptoms around, like if you have prolapse or if you have symptoms where the organs aren't really sitting within a place of the pelvis that is really supported because your pelvic floor muscles aren't supporting them, that also puts difficulty through the organs to conceive, right? So all of that, just again, just kind of thinking of as like the pelvis needs to be as healthy as it can be, or it operates better and everything goes a lot smoother if the pelvis is as healthy and functioning as it can be. And so knowing that you have some symptoms ahead of time just doesn't mean it won't happen, doesn't mean that you can't conceive. But if you are having difficulty, those things could be contributing to the difficulty. And so by setting the pelvis up to be as functioning as it optimally can be to optimize that function, optimizes the conception.
So, in a large multinational study, between 70 to 80% or 86% of pregnant people reported experiencing pain around their hips and lower back. And the US falls within this higher range, possibly due to factors like higher obesity rates, sedentary lifestyles, stress. Can you explain why pelvic pain is so common in pregnancy and what do you think contributes to these higher rates in the United States?
Yeah, great question. I think one, to destigmatize pain during pregnancy, there's so many changes. Your body's rapidly changing during pregnancy because of what you're doing. So both making the baby, but then creating space for the baby, and then the hormone changes that have to happen. So much is changing so rapidly that to expect that there would be no implications of that for the woman's body is sort of not realistic, right? It kind of makes sense that we would have potential issues, and most people have things that pop up throughout their pregnancy while they're pregnant because of the natural changes that have to happen to accommodate the baby. So some things that we know for sure, your ribs have to flare up in order to make space for the baby, which is going to change breathing, which is going to change some of the mechanics of how we use our mid back and our low back. Posture often changes because of the weight in the front. And so we end up maybe having more arch in our low back or a pelvis tilted forward. Some people actually go the other way and kind of clench their butt and their pelvis gets tucked under. But that's because you're supporting more weight, and there's more weight in the front and there's more weight in your abdomen than you typically have. And again, it happens really quickly. And so often we don't have a lot of our muscle function growing with the changes of our body. And so we can expect that those things are going to have an impact on the woman's body, and it might cause her to have some difficulty with pain or with movement or with function. So I think, first of all, it's totally common and it is quote unquote normal to have these things, these changes happen. But what shouldn't happen is that women don't have support around it, that they don't have any guidance on how to help their body change with the needs of the pregnancy. The reason I think that it happens maybe more in the United States, we don't have as much education or sort of natural referrals to pelvic health as other countries do, particularly around pregnancy and postpartum. A lot of other countries, it's a automatic referral to pelvic floor physical therapy, particularly in postpartum, but also in pregnancy. And so there's maybe more inherent recommendations of someone guiding you through those changes in different stages of your pregnancy and postpartum. I don't know about the difference in terms of how many desk jobs or how much of a sedentary lifestyle we have, but I know we often have a little less walking. We might be a little less active. We don't have as much maternity leave. We don't have as much support around maternity leave. And so I think a lot of women are really working as hard as they can up until the time that they can leave. And so they're not really taking a lot of time or have a lot of time to support their body to change with the pregnancy. And I think that's the big key is that, and what we do in pelvic floor PT and someone who's going to guide you through with exercise and with education on how to help your body change with the pregnancy so it doesn't have dysfunction within the pregnancy.
Yeah, you bring a good point because in some other countries, let's say in some European countries, you could have 2 years or 3 years of maternity leave and you allow your body to naturally come back. It takes a while until your body recovers from the
Yeah.
pregnancy and all the bad habits that you've kind of accumulated, the posture, the breathing. And if you have to go back in the office 3 months later and sit in an office, it doesn't make things any better.
No,
So,
and yeah, in fact, that like really contributes to it because you're getting used to that sitting position again. And you don't really have a chance. You're working full time, and so you don't really have the energy and the time. You're recovering postpartum, so you already don't have the energy to really do some of the exercises and take care of your body in the sort of optimal ways. And then you add a full time workload on top of that, and many people are just exhausted and want to go home to their baby that they also had to miss out on all day and not really want to take the time to take an exercise class or to go to a session to like help their bodies feel better because they feel like they have other priorities, and that's understandable. But that all stems from the idea that you spend 8 hours of your day at work instead of for right away 3 months after you have a baby versus getting to spend a lot of quality time with them for a year or 2 years and then feeling a little more comfortable with the time away and feeling a little more like comfortable going back to spending your time at work. So I think there's a lot of factors there that
yeah.
play into it. And then from my understanding, even in other countries, there's actually more pregnancy leave time as well. I know women can go out or people can go out earlier
Mhm.
in other countries before they give birth, which is a little more uncommon here in the United States.
So, what do you think is the solution then in the United States? Yes, you're not going to have as much time, but maybe educating yourself at least early on before pregnancy about what's ahead, what to expect, and what kind of help you're going to need down the line. I think that's going to save you a lot of time.
Yeah, I mean, definitely we recommend pelvic floor PT during pregnancy. And sometimes it's hard in the trying to conceive to really like extrapolate into pregnancy just because no one really knows what their pregnancy, how their body's going to feel during pregnancy. And so there's a lot of things that could pop up while you're pregnant. But once you're pregnant and going through pregnancy, kind of seeing how your body is changing with the pregnancy or what kind of support you need. It's almost like muscle memory. Like we talk about it like muscle memory. If you've been given that training, how to use your core, how to find your core, how to use your pelvic floor, how to find your pelvic floor. What does it mean to contract your pelvic floor and use it? What's the education around when you should contract your pelvic floor and when you should stretch it and relax? If you learn all of that while you're pregnant and can implement it while you're pregnant, then when you're going through the postpartum phase, you almost already have the muscle memory. You might need a little support around reminding yourself, but you have some muscle memory there, which means things come back a little quicker. You're
Mhm.
already more aware of what you're supposed to do, like what it feels like to do it right. And so it's a little bit easier to take things on your own. It's a little bit easier if you have a virtual program that allows you to stay home and do your exercise at home versus going and doing them with a therapist, right? So it allows you to take on a little bit more on your own because you already have the training from your pregnancy that is pretty much the same. It's just you have to reestablish it once you've given birth.
Perfect.
Yeah.
Important. So start early on.
And, you know, early in the second trimester is really helpful because you're not really that different yet. You don't really have a lot of the extra weight and the extra blood and all of the things that make you feel different in your pregnancy in your early second trimester. So it's almost like you're learning with your a little bit like your pre-pregnancy body or not like what your postpartum body is probably going to be like. And so learning it then also gives you the whole rest of the pregnancy to practice, use it to your advantage, and not wait until you have a problem that then you're trying to solve versus kind of staying ahead of it by doing the exercises and learning these things early before there's problems.
Being proactive. I get. Let's cover urinary incontinence. So leaking pee when you laugh, when you cough, or sneeze, or exercise. That was one of the topics that came out when I got pregnant, and I was talking to other friends who have already gone through this. This was one of the things that they were talking about, and it affects more than 50% of pregnant women. And tends to increase as pregnancy progresses. It's often embarrassing. It can restrict your daily activities. So, why does urinary incontinence happen so frequently during pregnancy? And how can pelvic floor therapy help manage or prevent it?
Yeah, definitely something we treat a lot in pelvic floor PT. Probably one of the number one things associated with pelvic floor PT because it's so common in so many people, particularly pregnant and postpartum people. There's a lot of reasons, but there's twofold of why urinary incontinence increases when you're pregnant and then increases throughout your pregnancy. One of them is just physiologically what's happening. Your bladder is getting less space as the baby grows because it's pushing down on your bladder. And so the bladder is getting kind of smaller, which means there's less space for you to be able to hold urine. And so it might catch you off guard that your bladder is so full. And so you're not used to going to the bathroom as often. Your bladder isn't used to holding or resisting against that weight of the
Mhm.
baby. And so you have more pressure downward, which puts more pressure on your urethra. Your urethra is the tube that we pee out of. And that increased pressure is also on the sphincters that hold it closed. And so by increasing that pressure, it makes it harder for those sphincters to stay closed. As the pressure increases and the weight of the baby increases, it's asking and sort of demanding a lot of those sphincters. And so they could fail. They could get too tired or too weak and have more leakage. Because often when people are having leakage with pregnancy is with what we call stress urinary incontinence. So like a pressure downward, a sneeze, a cough, a getting up from the chair or like picking something up or bending forward. And so since there's already pressure on the bladder from the baby, when you go to sneeze and you kind of like sneeze this way and sort of pressure down, it's more pressure than your urethra or your sphincters on your urethra can hold. And so then there's some leakage.
Okay.
Physiologically, that is going to happen to everybody. It's just how that's going to happen. The leakage doesn't have to happen to everyone, but that pressure is going to happen. The second reason that we have more control over that you start to leak a little bit more during pregnancy and then throughout is that our pelvis is changing. And so our pelvis is actually getting wider and a little more loose in terms of preparing for birth. So we have hormones that create more laxity within our system to allow for the pelvis to expand when it's time for the baby to come through the birth canal. And so our muscles, our pelvic floor muscles, actually have to work harder to keep the pelvis stable. So our pelvic floor muscles are like a trampoline. They sort of span the width and the circumference of the pelvis. And so if you think about if we started to make the width of a trampoline wider, the tension on those springs gets wider and wider and wider and longer and longer and longer. And that means that there's less bounce. There's less sort of ability for the trampoline to rebound and have a good support system when someone's bouncing on it. And that's what's happening to our pelvic floor. Things are kind of expanding. There's increased weight down. We're maybe walking a little bit differently, and our pelvic floor is trying really hard to keep things stable. And so they're really tense muscles. They start to get really tight and really tense from holding on so hard. And so that tension and that difficulty of the length of the pelvic floor makes it harder to have strength in your pelvic floor. So then you have a harder time contracting as hard as you used to when the pelvis wasn't widened and there wasn't so much weight on the pelvic floor. That we can do something about, though, right? So we can't change the weight from the baby on the bladder and the size of the bladder. But what we can do is in pelvic floor PT, both manage the tension on that pelvic floor. We can stretch and we can do some treatment to help decrease tension and improve flexibility and improve mobility of the pelvic floor muscles so it doesn't feel so taut trying to keep everything together. And then we can practice and actually improve some strength of those muscles. We can practice coordinated pelvic floor contractions during a sneeze, during a cough, during picking something up. And then also work on some strength, purely just getting a little bit stronger as your pregnancy progresses. So that tension and that trampoline actually stays more like a normal size or like a normal amount of tension instead of feeling really pulled to both ends.
Thank you for explaining this. So this is during pregnancy. What about postpartum? Sometimes you don't have this issue until after you give birth. So then you don't have the weight anymore, but I'm guessing you still have to work on that flexibility and mobility of the pelvis. The pelvis is probably still tight at the beginning. Is that why that could cause an issue?
Yeah, so all of those things happen during pregnancy and they don't necessarily like rebound once you give birth. So there's a couple things in postpartum that happen. So one is that you're still often dealing with the pregnancy situation. So your pregnant pelvic floor is still whatever status it was during that time. And I would say honestly, most people that I work with towards the end of their third trimester, there's a little leakage here and there for most people. And we talk about like as long as it's infrequent and like just kind of catches you off guard, probably just the way that's going to be for the last couple weeks. I'd say that that happens to most people. So if that's happening to someone out there, that can be really normal. And it is pretty hard to manage those last couple weeks of pregnancy. But before then, we absolutely should treat it. And I think a lot of people just sort of let the leaking happen and think it's going to go away after pregnancy. And so they don't treat it like, oh, whatever, it'll stop in postpartum. The problem with postpartum is that if you have a vaginal birth, there's actually trauma, right? So your pelvic floor has to stretch to 10 centimeters, has to allow the baby through the birth canal, through the vagina, the opening of the vagina. It often can have a tear, a grade 1 to 4 tear, hopefully like ones and twos or of the vaginal opening. And so you have some trauma to the area, potentially some stitches. I mean, if nothing else, it's really stretched out, even if there's no tearing, it's really stretched out. And so similarly to if you were to have a surgery or trauma to another joint, we need to like remind those muscles how to work. They've been through some traumatic things and they sort of lose connection to our brain. What's safe? What's not safe? Can I contract? Can I not contract? How do I do this anymore? It's almost like you lose that muscle connection for a little while because of the trauma. And so we need to reconnect. We need to have someone practice reconnecting with those muscles to be able to function and use them correctly again. There's a fair amount of coordination that has to happen. And so you need that retraining just to remind your body, how does this naturally work? So that's if you give vaginal birth. And so if you have a C-section, the truth is all those pregnancy things still happen. So if you have a planned C-section, then you still are dealing with the pregnancy residual. So you still need help with tension potentially in the pelvic floor because it was holding on so tight trying to keep the weight up. You might need some stretching and then just gradually returning to the strength that you used to have now that things are kind of returning back to your pre-pregnancy position. If you have an emergency C-section and you've dilated and you've gone through the process of trying to have a vaginal birth, all of the dilation still happened with your pelvic floor. So you actually are still dealing with as if there was some part of vaginal birth
Mhm.
and then a C-section. And so the last element to all of this, particularly around C-section, is that you can't use your core for 6 weeks after you have a C-section either way. And that actually puts more pressure on your pelvic floor as well, because your pelvic floor and your core have to work together. And so if you have a piece missing, if you have your core missing, your pelvic floor has actually been doing more work, had more demand immediately after giving birth as well. So that's actually a lot of factors as to why in postpartum we see these symptoms linger if you don't get support from a pelvic floor PT.
And based on my research, starting pelvic floor muscle exercises early in pregnancy, like you said, maybe the second trimester is a good time before that heavy weight,
Yeah.
can reduce the risk of developing incontinence by more than 60%, especially when it's done regularly and with the proper guidance. So, what types of pelvic floor exercises do you recommend during pregnancy? And how can people safely start and maintain these exercises?
The guidance is a really big piece. I think what really helps is having a pelvic floor PT tell you what a proper pelvic floor contraction is. So often in pelvic floor PT, we do something called internal work where we actually use one finger gloved with lubricant in order to feel the muscles of your pelvic floor. And we place our finger both at the entrance and then deeper into the deeper muscles of the pelvic floor. This allows us to feel the mobility and the flexibility of the muscles individually so we can really understand if there's a one-sided, a unilateral problem, a problem on one side, or a specific muscle problem, or a layer problem. We actually have layers of our pelvic floor, so it helps us understand if there's a problem within an entire layer of muscle. And so by doing that, the proper guidance can have you do a contraction and tell you what you're contracting, and if it's a good contraction, if it's an efficient contraction, or if we need to cue you or give you some ways to think about contracting in a way that's more efficient and more effective. So learning that's really important, because if you're practicing your pelvic floor contractions without that guidance and they're actually more butt squeezes than you thought, or they're more inner thigh squeezes than actually your pelvic floor, all that practice isn't really helping you in the long run. And so getting that guidance of really understanding what is a good pelvic floor contraction, what does it feel like in your body? How can you feel that accurately so that you can practice it is really helpful. And then beyond that, similarly to what I was talking about with like that tension on the trampoline, we often find that we need to mix and have a good amount of stretching, pelvic floor stretching and stretches involved in someone's program while they're pregnant, because it's working overtime to like keep things together and hold up the weight. Tension builds. And so if we can have a good stretching program, it allows for the strengthening to go more effectively. Something that's really stretched out just can't be efficient at doing a contraction. Like it can't, if you think of a rubber band that you overstretch, it now no longer has like a good amount of rebound, right? And so if something's overstretched, if our muscles are overstretched, or if our muscles are too tight, then we can't contract and relax appropriately. And so we find that we need to incorporate some stretching and some activation of the pelvic floor in order for things to stay working really well as the pregnancy progresses.
Interesting. So overstretching can be an issue, and we usually don't think about overstretching. We always think about, okay, I don't stretch enough. I need to stretch more. But overstretching is a thing.
Well, so the overstretching actually happens naturally where it's getting pulled to stretch. And then because of that, it's holding on to tension. So
Okay,
as it's like it's almost like if you pulled my arms on both sides, I'd want to like pull my arms in to try to like keep myself from being overstretched. And
got it.
so by the body kind of stretching out more, the pelvis kind of getting wider and then load on the pelvic floor muscles, they're actually getting tense in the overstretching. So yeah, thank you for correcting that. It's not so much that you're going to overstretch. It's
Got
that
it.
it's a natural overstretching in the body that then creates tension in those muscles to try to keep them from overstretching.
Perfect. Thanks for clarifying. Are there any specific exercises to avoid during pregnancy?
Not specifically, it's very person dependent. So, people can run and do really high intense exercises through their pregnancy as long as it's still comfortable. I wouldn't recommend adding really high intensity exercise or high demand exercises if that's not something you were used to pre pregnancy. So, if that's something you were used to pre pregnancy, we often recommend, as long as it still feels comfortable, as long as your body's still tolerating it. And tolerating it means not having any pain afterwards, not feeling any heaviness in your pelvis afterwards, and not having any of those urinary symptoms or bowel symptoms. So the urinary leakage, so any incontinence or having some significant constipation or even bowel leakage, as long as you're not showing any symptoms in your pelvis, if you're used to high intensity exercise, it's safe while you're pregnant. The key is that you have a little more awareness of how your pelvic floor should be contributing to those high intensity exercises. So we want your pelvic floor to really support you with your core. So whenever you're using your core a lot, you should feel like you're pulling in your pelvic floor, lifting up your pelvic floor as much as you're using your core. And that's really important. It's important all the time, but it's really important when you're pregnant. Otherwise, adding low intensity or maybe some strength training while you're pregnant, even if you're not used to that, with guidance is actually a really great idea and totally fine to add within guidance from a PT.
And listen to your body. It doesn't mean you have to continue at the same pace if it doesn't feel right or good for you.
Yeah, my rule in postpartum, and it's my rule in pregnancy too. I just don't see as many people coming in with this question, but my rule in postpartum definitely is your pelvis wins. So even though your arms can handle your really heavy barbell exercises, if you're feeling symptoms in your pelvic floor, if it feels funky in your core and doesn't feel like you're really stable or you're leaking, then you can't do it. Your arms didn't go through trauma. Your arms aren't supporting anything different. You know, even your legs, you might have really strong legs and your legs postpartum still feel really strong, but your pelvis and your pelvic floor during pregnancy and postpartum are different. And so you have to let it win and it guide you in your exercise choices. So you can try it, but if you feel any pelvic symptoms, your body's not tolerating it. Your legs are tolerating it, but your body's not tolerating
Yes. Yeah.
it.
I like that.
Yeah.
What are some signs that pelvic floor dysfunction is happening during pregnancy that people often overlook?
Great question. Starting to lose flexibility in like particularly sitting in like a cross-legged position could be a sign that you're actually having some inner thigh and some pelvic floor tension. Waking up a lot in the middle of the night to go to the bathroom, that can be, especially in your second and early third trimester, can actually be a sign of pelvic floor dysfunction. So it's normal to have to get up more often than you were used to, but it really shouldn't be happening to you till you're, significantly showing and later into the third trimester, because that's really when your bladder is a lot smaller. If it's happening in your second trimester or early third, it might be sort of what we call bladder habits. You might be forming the habit of peeing more often, and that's becoming some pelvic floor dysfunction and waking you up in the middle of the night. Definitely low back pain. So we talk about SIJ pain. So some people might not know what that means, but they're like your low back over your pelvis. There's spots on either side that people will sort of like point to and say like that spot really hurts. That can be a sign of pelvic floor dysfunction in pregnancy. And then the like lightning crotch or pubic symphysis pain in the front can also be a sign of pelvic floor dysfunction.
How about sciatica? It's a common symptom as well.
Yeah, sciatica can be related to your pelvic floor dysfunction. It can be a back issue and it can be a hip issue too. So it's not always, but it definitely is worth checking out when you're pregnant because pelvic floor could definitely be related to it. So sciatica for anybody can be possibly a pelvic floor reason for their sciatica. And I highly recommend anyone who has sciatica to see a pelvic floor PT to figure out whether it is or not. Because pelvic floor PTs can treat your back, they can treat your hip, but they have the missing link of being able to treat your pelvic floor and assess your pelvic floor and find out if it's contributing to your sciatica symptoms. So yeah, it definitely could be a positive sign of that.
I'm glad you covered those symptoms because usually you talk to friends and they tell you, oh, this is normal. This is
Yeah.
part of pregnancy, but it's not always normal. And it depends when it happens. Is it in early pregnancy, later pregnancy?
It definitely matters. And I think that is the misconception, right? So just because you're pregnant doesn't mean those things should happen. They tend to happen. And our phrase that we really like is things can be common, but not normal. And so, yeah, all those things are really common in pregnancy and they don't have to be normal. They're not normal things that people should just have to live with. They're common things that happen that actually there's a lot of support and improvement for. And I hear a lot from parents too, or from moms too, like, oh, whatever, I'll deal with it later. Like, it'll go away. And I get that. I get you've got a lot going on while you're pregnant. But at the same time, the more we handle it while you're pregnant, the sort of smaller the issue is, the easier and more manageable it is for you. If we let it get kind of bigger, the bigger management strategy we have to have. So if you are experiencing these symptoms, even if they're really minor, that means that the solution's probably minor. And so having some help around it could maybe clear it up, help you with some issues without having to invest a lot of time and energy into treatment. If we let it get bigger, you just let it go on and you add other elements of postpartum on top of it, now the solution, the time you have to invest in feeling better in your treatment is probably bigger. So the faster and the sooner we get to something that's dysfunctional, actually kind of the easier it is to treat for the patient to deal with it. And the sooner they can move on and feel less like it's cumbersome for their life in the long run.
So, persistent and chronic pain affects 1 in 4 new moms postpartum, and it often interferes with mobility, sleep, even bonding with your baby. How can pelvic health therapy address this pain and support healing?
Yeah, so this is huge. And I think it's really important that women know that you can get pelvic floor PT starting within 2 weeks of giving birth. You'll hear a lot of people say wait to 6 weeks. And 6 weeks is when we can, as long as we're cleared by the OB for healing, assess the muscles internally again. But if you're having problems off the bat with feeding, moving, getting in bed, lifting up your baby, as soon as 2 weeks after birth, having a PT and particularly pelvic floor PTs really address that with you and help you find some strategies to improve that can really make a difference moving forward and sort of avoid the chronicity of some of those things.
What are some common misconceptions about postpartum recovery and pelvic health that you'd like to clear up?
I think the biggest one is that it's just going to go away on its own, and including like the leaking. I know a lot of people, yeah, I just had a baby and yeah, I'm leaking, but it'll go away. And sometimes it does. Sometimes people are lucky and it does and their body just kind of figures it out, but I'd say majority of the time people are still dealing with those symptoms 5, 10, literally, honestly, up to 30 years later. We treat people who, when we really talk about their urinary incontinence, they're like, honestly, it started when I had my baby 30 years ago. So they don't just go away. And there's a lot we can do to help. And the quality of life, your quality of life with your kids and your quality of life just in general goes way up when you're not having to worry about where the bathroom is, or if you have pads, or if you can't jump on the trampoline with your kids or run around the park. So, we absolutely can help with those things, and don't just live with them because they're normal and that they'll go away.
How does pelvic floor therapy help with other issues such as prolapse symptoms or even sexual dysfunction, a topic that not everybody wants to talk about, but it's obviously very important?
Yeah. And it's really important, I think, in the pregnancy postpartum world and in the trying to conceive world. So if we start with the sexual, lot of people, and I don't have the current numbers on me right now, but it's upwards of like 90% of moms will report pain with sexual activity 6 months after having a baby. Your identity's changing as a mom, but like you're still trying to be intimate with your partner, and there's so many parts of you. There's a piece of you that is that sexual person with your partner, and have that experience and identify with that, and to take that away too and change that identity and feel like you can't participate in sexual activity with your partner without pain is challenging emotionally and mentally as well as physically. And so by addressing the pain and improving how your pelvic floor muscles, and truthfully it is very common because of all the things we just talked about, the trauma that happens in the pelvic floor both during pregnancy and potentially during birth, hormone changes during pregnancy and then while you're breastfeeding cause more dryness in the vaginal region, and so can cause more friction and irritation, which can cause pain. So there's a lot of reasons why this could happen, and it is not necessarily means that there's something wrong. It just means we have to identify how to help it improve. Can really help you feel a little more like yourself and a little more mentally and emotionally connected to your partner. Can help you feel like you have that part of your identity back, or you're rediscovering that sexual identity for yourself. And that is really important for everybody to have that aspect of themselves, and particularly as your identity is already shifting as a mom or a mom of many, if this is multiple kids, that part of your identity you still want to have, and you should still have it.
And I assume you tend to have more sexual dysfunction after giving vaginal birth, but maybe if it's a C section, it's not as common of an issue.
Well, it depends on that planned versus unplanned C-section, or sort of how far down through the vaginal birth pathway you went. But also the breastfeeding part. So if you're breastfeeding, your estrogen is significantly lower, and that actually is what you need for lubrication and for moisture in the vaginal region. And so even with a C-section, you could still have the irritation from the lack of estrogen that then contributes to painful sex.
Makes sense. Yeah.
Yeah. Your other questions roll around prolapse. So
Hmm.
pelvic floor PT particularly has a lot of help around helping suspend. That's one of the jobs of the pelvic floor, is to suspend the pelvic organs in the pelvis in the proper way. And so prolapse means that some of the organs are sort of starting to descend down the vaginal canal, whether it's the bladder, the uterus, the rectum, or even the abdominal tissue contents. So that means that they're not getting as much support. They have sort of lost their passive support, and pelvic floor PT can really help the active support of your muscles suspend the pelvic organs where they need to be. And sometimes when you have that, heaviness is a big sign of prolapse, is typically when people report or feeling like a bulge coming down or out of the vaginal canal. But even some urinary issues, urinary incontinence and urinary retention issues, can be related to prolapse. And so even if you're having some urinary issues, there could be some relationship to prolapse. So pelvic floor PT can be really helpful in identifying that, helping you with resources, and helping you have your muscles work in a way that supports the organs better.
And I realized that pelvic health physical therapy also assists in conditions, for example, when you have bowel issues like constipation, or if you're trying to heal from, if I'm saying this correctly, pronouncing it correctly, diastasis recti.
Diastasis, yep.
I didn't even know that these are things that physical pelvic physical therapists can assist with. And then how can you assist with these conditions?
Yeah. So, one of the differences of the pelvic floor muscles from a lot of other muscles in our body is that they interact because they're responsible for peeing, pooping, and having sex. So, that's the job that they have. They integrate with and respond to and work with those organ systems. So, your bladder, your rectum, your uterus. So, people with endometriosis or painful menstrual cycles, or like any sort of condition related to the uterine lining or uterine tissue as well, pelvic floor PT has a lot of tools and things we can help with as well. But because they interact with those systems, they're influenced by how those systems work, and they influence those systems on how they work. It's a two-way street between those systems and the pelvic floor muscles. And so when it comes to bowel conditions, particularly if the bowel conditions kind of started first, if there's a lot of diarrhea or if there's a lot of constipation from a digestive problem, the pelvic floor muscles get out of sync of understanding how to work with the digestive system correctly, and can get off coordination, can have too much tension to try to hold things in. Some people, if they've had a lot of diarrhea, their pelvic floor muscles are working really hard to close down the anal opening because they don't want to be leaking. And that over time can create that same sort of tension problem we were talking about earlier, where there's not enough relaxation, there's not enough mobility in the muscles to allow you to have a good bowel movement. So then you're trying to have a bowel movement, but your muscles don't know how to relax because they've always been holding back because of the diarrhea. And so now things are just confusing, right? Your muscles are confused, your system's confused. And so we can help with that. Constipation is actually a big issue that we really do a lot of help with. Not everybody knows how to poop. In fact, I don't think a lot of people know how to poop correctly, and how to not strain, but how to allow your muscles to do the pushing, and how to help your muscles do the pushing instead of straining. And that extra load and pressure through those sphincters can be really difficult for them to tolerate and weaken them and make them feel confused and unsure how to coordinate the timing of allowing you to have a good bowel movement. So we help with that. We help with teaching people how to push correctly. We help with teaching people, or helping those muscles open, helping with positioning of the pelvis so that you can be in a better position to have gravity help you have a bowel movement. What does that mean? What does that look like? Just the muscles, because they're responsible for peeing, pooping, and having sex. If there's a pooping issue, often the muscles have some sort of involvement in that, whether they were the start of the root cause, or now they're just involved because the digestive system has had some issues or some difficulties. They're now involved in the way that they function.
Hmm.
Diastasis recti, often we're working more with your core muscles to help support your diastasis recti, and your pelvic floor is part of your core muscles. So your pelvic floor is one of a four system muscle group that makes up your core. We often talk about our abdominals, sort of our what we think of as the front of our muscles as our core, but actually our core is the stabilizing muscles in our back, the muscles that wrap around the front, our pelvic floor, and actually our diaphragm, where we breathe from. Those four muscle groups really create, when they work together, create a really strong, stable trunk or abdomen and are the all of the pieces for your core. And so when you have a diastasis, if anyone doesn't know what that is, it's sort of like that widening gap in your abdominals that sometimes there's a bulge or a valley that comes through. That's those are really your organs kind of popping through that gap. What it is a miscoordination and a miss level of strength of all of your muscles that have to work to support your abdomen and your core. So we know that almost 100%, if not 100% of people on the day they give birth have that thinning and that widening of the what's called the linea alba, that line, because it has to accommodate the space for the baby. So the baby has to have space, and the space that it's taking up changes so quickly that our body only kind of widens to accommodate it. It can't create more tissue. It just sort of widens to accommodate the baby. And so we have a bit of that widening at that space. Some people will call it a separation. I think that kind of sounds like it's separated. They're just wider than they're used to. And so when you don't have a good core contraction, you don't pull those muscles together enough. And so instead of these coming together, they stay wide, and then it has space for the pelvic or the abdominal tissue to kind of pop through. And so, what we work on in pelvic floor PT is a lot of core work and coordination to help pull your muscles, your six pack muscles, closer together so that it's more stable and sturdy. And then using that correctly when you're doing activities like picking something up, playing on the ground, getting in and out of bed, exercising, all of that.
Can exercise, the wrong exercise, cause diastasis recti?
So, yeah, there's kind of a misconception that only happens in postpartum people. It definitely happens in other people. Seen it in men a lot, actually. So it can happen for anybody. It's anybody who has poor timing of your core muscles or poor strength or a mismatch of strength in your core muscles could have this happen. When you're doing exercises, the only bad exercises are the ones that cause you to have that sort of popping through your, like, if you, we call it like a potato spud. Like if you see like a little like punch through your that midline, that's a bad exercise for your body right then to do that exercise. That means it's causing you to have push through the organs pushing through a little bit, which means that you're creating pressure instead of creating a core contraction. You're like pushing out in that space instead of creating like a corset or like a trunk shield that keeps everything together. And so there's kind of this misconception that there's like good exercises for it and bad exercises for it. And you'll see lists out there that tell you that. And the reality is everybody's body responds to exercise differently. So the only bad exercise is one that causes that spud to pop through or a valley to happen. Every other exercise that has you use your core that you can do without having that happen is a good exercise for you.
Okay, perfect.
Yeah, it's very person dependent.
Like a lot of other things.
Yeah.
So finishing up this episode, my last question: what's one important message you want everyone who's pregnant or postpartum to hear about pelvic health?
Your pelvic floor is gonna have changes while you're pregnant and into postpartum. It's gonna have challenges. It's gonna be affected by the journey just because that's how our body changes, and it's changing in our pelvis the most. And so, even if it's just to check in and make sure that things don't get symptomatic, taking care of your pelvic floor can be a game changer for many, many years into postpartum if you do it while you're pregnant. So, taking that time to get an assessment, get some guidance, have someone on your side that already knows about you and your pelvic floor can really save you a lot of time and sort of difficulty for years to come into your postpartum journey.
Thank you, Chelsea. This was very, very educational. I love that.
Yeah, thank you so much for having me. It was really fun to talk to you.